Hi, I'm Joe Carmichael. I'm one of the surgeons here at UC Irvine and the director of the OR. And I wanted to introduce you today, before the OR gets really busy, to some of the things we have here. One of the first things you'll see is these video systems. The video systems in this room and all our rooms in the main OR is fully 4K integrated. And what that means is when we take an image or a video from the table, it runs through 4K fiber optic cable, 4K switches, and down to these 4K monitors. And that's actually a really unique thing. I think we're one of the only ORs in Southern California to have such technology available. It also helps us teach. So if you see up here are some cameras up on the walls. And with this 4K video system, we can broadcast around the country or around the world. We've broadcast as far as South Korea or Europe and had interactive lectures with surgeons there, and they watch us operate and we talk. And it's kind of a little bit like what we're doing now. There's a lot of technology built into this room, a lot of electrocoagulation equipment, special insufflators, video C-arms, and then over here, you'll see one of our Da Vinci Xi surgical systems. We have 3 Da Vinci Xis on this floor and another Da Vinci Xi just for teaching in the lab. And then we also have a video gaming environment teaching for Da Vinci Xi. But one of the things about a real robot and sitting down on it is that you get a feel for how to dock the instruments, how pegs and other inanimate objects handle in the robotic instruments. You get a real feel for what it's really like. And that's actually really unique to have a robot just for teaching, considering the costs of these. And that was through a partnership with Intuitive. The OR is a pretty busy place. We'll do about 20,000 cases this year. We do living-related kidney transplant, pancreas transplant, cardiothoracic surgery. We have a couple licensed cardiopulmonary bypass rooms. We do a ton of neurosurgery with the ability to CT scan the patient in the OR, and robotics and neurosurgery, as well as a lot of other technology used for that. We have multiple divisions that you'd expect at a busy, large academic medical center. Vascular, cardiothoracic, colorectal, minimally invasive foregut surgery. We do totally laparoscopic Ivor-Lewis esophagectomy here. And the person who developed that, one of the primary developers of that procedure, Dr. Ninh Nguyen, works here. We do partial laparoscopic nephrectomy. The person who described that surgery, Dr. Jamie Landman, and did the first laparoscopic partial nephrectomy, is here as the chair of urology. We also have Alessio Vigazzi here. He did the first robotic rectal resection in the world. And so we have a real bent towards minimally invasive surgery across multiple divisions. And that's one of the things I think that makes us unique. Another is just a real investment in our technology and the things that you would have available here to use at UC Irvine. In Orange County, we're the only level 1 trauma center, the only academic medical center, and it makes it a very busy place. Of course, this is the 6th largest county in the United States, and so there's a lot of activity in this OR. Down this direction are the trauma rooms, which have very direct access to the emergency department and where we can immediately go to surgery. Neurosurgery rooms are down that way. Across this direction, we've got a fleet of minimally invasive surgery rooms. They're all built for minimally invasive surgery and fluorescence imaging in all rooms, that kind of thing, and all the technology we need. And then back this direction is our clean core and a whole lot of supplies that we'll use throughout the day. And as you can see, there's a lot of hustle and bustle around here because we do a lot of cases. So thanks very much for your attention.